30 minutes today. We have Dr. Moore and Dr. Yaffe here. When we get to the question and answer portion, just a reminder, it's one question, one follow-up, and I'll pass it over to Dr. Moore for some opening remarks.
Good afternoon, everyone. I'm going to first invite Dr. Yaffe to provide some comments and observations about our latest data before offering my own reflections. So over to Dr. Yaffe.
Thank you very much, Dr. Moore, and good afternoon, everyone. Today, there were a total of 46 new cases of COVID-19 reported in Ontario. We have 173 people currently in hospital with COVID-19 and 192 in the intensive care unit. Of those, we know that 2 of them are from Manitoba and being cared for in our hospitals. So we actually have 190 Ontarians in ICU with COVID-19 related illness. I'm sorry to report we do have 7 more deaths reported from COVID-19. I'd like to offer my sincere condolences to everyone who has lost loved ones through this pandemic. A total of 17,489 tests were processed yesterday with a positivity rate of 0.8%. Our average positivity rating in the last 7 days is 1%. Our current 7-day average for daily shots in arms is 193,148. Though our vaccination rate has slowed a little, we are still vaccinating close to 200,000 people each day. Over 17 million doses of vaccine have been administered, with over 7 million Ontarians who are now fully immunized. 78% of our population in Ontario, aged 12 and over, have received 1 dose of a vaccine, and just over 54% have actually received their 2nd dose. Overall, we are continuing to see positive trends, but we remain very concerned about the Delta variant. This has emerged as a global variant of concern, which is being taken very seriously across the world and has replaced Alpha as the dominant strain in Ontario. We know it is more transmissible than other strains of COVID-19. In fact, since it was declared a variant of concern, we've had over 20 outbreaks where Delta was the dominant strain. Currently, it's estimated that 88.6% of our cases in Ontario are from the Delta variant. The outbreaks we have seen in Ontario have been a result of gatherings where people are in close contact without a mask and not social distancing, coupled with low vaccination rates. Grey Bruce and Waterloo continue to have the highest case rates of COVID-19 in Ontario, and they both continue to struggle, particularly with the Delta variant. Despite that, the people in both regions have made a remarkable effort to protect and care for each other by getting vaccinated, and as a result, both regions are seeing their case rates drop. The 7-day average continues to decline in both regions, showing what can be achieved when you adhere to strict public health measures and increase vaccination rates, even in the face of the Delta variant. This hard work has led to Waterloo Region being able to lift the restrictions that had prevented them from enjoying the activities that the rest of the province are experiencing in Step 2. I also understand that Waterloo had a record-breaking weekend where they gave more than 12,800 doses of vaccine out, and that broke their single-day regional record. So that is an unbelievable achievement. Congratulations on that. It is particularly important to get 2 doses of a COVID-19 vaccine for everyone as soon as possible, but especially if you live in a Delta hotspot. We know that the herd immunity threshold for Delta is higher because it is more transmissible. So to respond to this, it is essential that you get 2 doses of the vaccine in order to help prevent hospitalizations and further outbreaks. We are aware that the World Health Organization's chief scientist made comments recently in the media on the mixing and matching of different COVID-19 vaccines. We continue to advise Ontarians that mixing of the mRNA vaccines, Pfizer and Moderna, as well as mixing AstraZeneca and an mRNA vaccine is safe, it's effective, and it enables people to get their second dose sooner. We are following the advice of the National Advisory Committee on Immunization, which recommends it is safe to mix these vaccines based on studies from the UK, from Spain, from Germany, and they have found that mixing these vaccines is very safe and produces a strong, effective immune response. Of course, we will continue to monitor the data and work with the National Advisory Committee as well as the federal government on this. With that, I'm going to turn it over to Dr. Moore for his comments. Thank you.
Thank you, Dr. Yaffe, and thank you to all Ontarians for getting immunized and adhering to public health measures. We're entering stage 3 in a very good position, as Dr. Yaffe has outlined. But there is more to be done. As Dr. Yaffe mentioned, Waterloo is a prime example of what immunization against COVID-19 can do, but also serves as a reminder of what the Delta variant can do if it goes unchecked. The Delta strain will seek out unvaccinated individuals, and so becoming immunized as soon as possible will ensure that you are not on that path of least resistance for the virus. We want to see a continued improvement in vaccination rates throughout the summer and into the fall so that we can see a return to in-person learning while also handling the anticipated rise in infections that cold weather and indoor activities may bring. Delta will want to surge and return in September, if not earlier. All you have to do is look around the globe and see the increased activity in countries where Delta has gone unchecked. It's very important that we continue to prepare and respond now. I'm urging those who have not yet received their first dose to do so as soon as possible, as time is of the essence. If you haven't considered getting immunized or have any hesitations at all, reach out and ask questions. Talk to your family, your friends, your neighbors who have received the shot. Talk to your nurse, your healthcare provider, your pharmacist. They all want to ensure that you have the very best information and that you feel comfortable with getting immunized. We've all made sacrifices, individuals, families, and businesses, and we want to enjoy music, getting outdoors, dining out, seeing friends and family, and attending social events. But this must be done in as safe a manner as possible to protect lives and the long-term health of all Ontarians. I want to repeat my call for arms. I want to remind every Ontarian that anyone aged 12 and over are now eligible for their first and second doses of the vaccine. And especially if you're between 18 and 39 years of age, it's important that you get vaccinated as soon as possible, as you are in the age group where we are seeing the highest instances of COVID-19 infection as a result of low immunization levels. So over the last 3 months, of the 45,970 of 19 to 29-year-olds that tested positive for COVID-19, over 96% were unvaccinated cases not yet protected through immunization. In the 12 to 17 age group, of the 11,721 cases we have had in Ontario over the last 3 months, that number was 99.3%. Last week, I said 58.6% of 12 to 17-year-olds had their first dose. And as of today, that number has risen to 60.6. So thank you to all who have come forward, but we need to get this figure climbing more rapidly with the close approach of school. Only 21.8% of 12 to 17-year-olds are fully vaccinated with 2 doses. We've been on calls with the local public health agencies and immunization partners around the province who are seeing this lack of uptake in the younger age groups and are looking at ways to encourage them to step forward and roll up their sleeves. And I'm sure most of Ontario's youth are tired of staring at computer screens when they would rather be catching up with friends in person. We all want to see schools return as close to the pre-pandemic normal as is safely possible, and solid health and safety protocols, coupled with an increased vaccination uptake, will help to ensure that this happens. It's never been easier to get a COVID-19 vaccination than it is today, and mass immunization clinics are being deployed across the province to remove as many barriers as possible to someone getting the vaccine. And for someone who doesn't want to go to a mass immunization clinic, you can go see your local pharmacist, or you can start to see your primary care provider, as they will be playing a bigger role in the vaccination strategy during this last phase. In collaboration with public health units, primary care physicians and teams in approximately 700 primary care and community settings have been administering COVID vaccines in their offices and pop-up clinics and temporary locations such as arenas, mosques, temples, churches, in efforts to make it easier for Ontarians to access vaccines in their communities. And there are more and more walk-in vaccination sites opening up in Ontario. Examples are in Toronto and Hamilton, where no appointment is necessary. So I'm happy that we are all moving together in step 3 on Friday and to continue cautiously and safely reopening our province. We've now been in step 2 of Ontario's roadmap to reopen for almost 2 weeks. We're keeping a close eye on several of the indicators that Dr. Yaffe has announced today, and they are all trending in the right direction. Our vaccination efforts are paying off, and key indicators are trending correctly. Despite all this excellent work, we need to remind ourselves that as we move indoors for the first time in over a year, it's important to be cautious and follow the public health guidelines. In alignment with guidance from the World Health Organization, we're continuing to recommend strongly that people wear a mask indoors and at large gatherings outdoors. This extends to even the fully vaccinated, and this will help reduce community transmission, especially of the Delta variant, as we begin to reopen the province. So as we look beyond step 3, I know we can achieve 80% immunization with 1 dose and 75% of eligible Ontarians aged 12 and up if we set our minds to it. That is our goal in the next 21 days. We have the supply, we have the capacity, and having 80% of eligible Ontarians vaccinated will significantly slow this virus down, decrease its ability to spread and cause harm, and will make our lives a lot easier when the virus really wants to start spreading in the fall. Too many Ontarians have lost a loved one, have been hospitalized, have had to be in the intensive care unit, and it's been a year that's taken a tremendous toll on our society. The simple act of wearing a mask, washing your hands, and getting immunized can help us reopen safely. Thank you to all who have worked so hard to provide immunizations to those in our community. The local public health agencies, the pharmacists, the physicians, the hospitals. Now we have a steady supply of vaccine, and the studies are all pointing to their safety and efficacy. Vaccinating the last 10 to 12% of Ontarians will be difficult, but it is required if we're going to be opening safely against Delta. If you have concerns about the side effects or future effects of the vaccine on your health, talk to your healthcare provider. In the interim, wash your hands, wear a face covering, get immunized, and let's build community immunity to best protect all of us for the fall. These activities will reap dividends for the province going into step 3. And with that, I'll open it up to questions.
We'll go to the phone line for questions. First question, please.
Your first question comes from Randy Rath from CHCH-TV. Randy, please go ahead.
Hi, doctors. You seem to be saying that we should expect a surge in the fall of the variants. Are Ontarians going to require a 3rd dose of booster shot this fall, doctors?
Thank you for that question. Certainly, we have heard, particularly, I believe Israel is now giving out a 3rd dose or a booster to people who are particularly susceptible to or at increased risk of infection and serious sequelae, such as seniors, people with transplants. At this point, we have evidence that the 2 doses are very effective in preventing not only infection, but particularly serious illness and hospitalization and death. So we, of course, look to the advice of the National Advisory Committee on Immunization, which is always monitoring what's happening across the world. the studies on vaccine effectiveness and safety, and of course the epidemiology of the infection in Canada. So at this point, there is no recommendation for a booster dose in Canada, but of course we are always watching and working together with NACI and the federal government on that.
And as far as the question regarding a surge, we've been working with Public Health Ontario and the Science Table. They have done the modeling that has shown that we can expect a rise in cases as we go indoors, as the cold weather comes for September. And last summer, we had the same type of lull after public health measures were in place. Populations are dispersed across Ontario. They're taking great advantage of the outdoors, but as soon as we come back to the indoors, normally all respiratory viruses start to come back, especially around the third week of September in congregate settings, schools, universities, colleges, workplaces. So I absolutely expect a rise in COVID activity in September. We are preparing from a local public health agency vantage point all the way through to respond to a surge, and hence the real call to arms that we need now to build the best immunity through immunization possible to protect our population. No one wants to see our health system impacted. No one wants to see more people in the intensive care unit. And all of that hospital activity is preventable through immunization. Immunizations decrease your risk of hospitalization significantly, and the risk of going in the intensive care unit, and the risk of death. And hence, we really, really want to have the highest immunization rate possible heading into September. And have to thank all the Ontarians that have come forward so far, but we have a ways to go still.
Follow up?
Today we've seen that Seneca College is not going to allow anyone onto their campus who hasn't been fully vaccinated. There's nothing stopping any business in the province from saying that they will only serve fully vaccinated patrons. Is this a good public health move? Does it make sense not to, to exclude people that haven't been vaccinated from some aspects of society?
Yeah, thank you. We're aware of Seneca's policy. And we also know that some other post-secondary institutions have are implementing policies, particularly around their residences. I think as a public health physician, I would strongly support anything that will increase people's ability to get vaccination. And so having a policy that enables people to get vaccine is important. Of course, as I understand it, their policy is that either you get the vaccine or you have a medical exemption. So in other words, they don't absolutely have to have the vaccine. They have to have tried to get the vaccine. And in the rare circumstance there's a contraindication, they would have a medical exemption. But I would say I am supportive of policies that will increase people being protected. As we've said, immunization is the most important measure people can take to protect themselves and others from this infection. And they're coming into the fall where they're going to be congregating, and we need to do whatever we can to improve their protection.
Next question.
Your next question comes from Laura Stone from the Globe and Mail. Laura, please go ahead.
Hi, doctors. I wanted to ask about the idea of a vaccine passport. We know that this is something that Ontario has considered in the past. What is the status of that, and what are your recommendations as to why or why not Ontario should pursue this?
Yes, I can.
I understand that the federal government is actively looking at the issue of a vaccine passport or some way of certifying that an individual has been vaccinated and is fully protected. So it's an issue that obviously comes up at the border, and so we are very much looking to the federal government for advice on that issue.
Follow up?
Okay, thanks. That doesn't really address the question, though. I'm not asking about, border measures. We know some provinces are coming up with a domestic version. The Toronto Board of Trade came out today and said that Ontario should come up with one. So are you just punting it to the feds, or does Ontario have an opinion about whether this should happen or not?
So a passport would be for international borders, which would clearly be a federal responsibility. A passport for within Ontario has not been contemplated by this government. The vision of this government has been to have the highest immunization rate possible through non-mandatory means to protect the population and communities and businesses. And that is going very, very well. And have to thank all Ontarians to have achieved a rate of immunization already of 79.4% of 18 plus, with 57.2 18 plus having their second doses is remarkable, and without any mandate and without any passport. So I don't think it's necessary at this point, given that Ontarians are coming forward and getting immunized at such a great rate.
Next question.
Your next question comes from Robert Benzie from the Toronto Star. Robert, please go ahead.
Thank you. Dr. Moore, last week you spoke at length about the 83% of cases, of new COVID cases between May 15th and June 12th were from people who weren't vaccinated. I think you might have mentioned some new data in your opening remarks, but I was paying attention, but perhaps not paying attention as much as I should have been. So I was wondering if you have updated numbers of, more recent than May 15th to June 12th about whether people have been vaccinated and have received, whether they have one shot, two shots, and who's getting COVID and so on.
I did quote various age groups, specific age groups over the last 3 months. So that's the newest data that we have. And of the 19 to 29-year-olds that tested positive for COVID-19, it's a very socially active age group, 96% were unvaccinated, so not yet protected. And the 12 to 17-year age group, we had 11,721 cases in the last 3 months, and 99.3% were unvaccinated. So there's clear indication that vaccination is protective, and that age group is coming down with a higher rate of disease than other age groups across Ontario. And they're a key metric because they're the ones that are going to be going to high schools, to colleges, to universities, to workplaces, and potentially, unbeknownst to them, if they're carrying the virus without symptoms, spreading it in those environments, and then it can go to other workplaces, back to families, and then to intergenerational families. So they are a key target of ours going forward to try to increase our protection of those populations.
Follow-up?
And as a follow-up, do you remain confident that August 6th is a doable date to reopen, I guess, to get out of step 3 and move back to whatever normal is in the post-COVID world?
Yeah, so great question. I think it's going to be a bit of hard work for us all to achieve that high in immunization rate. At a population level, we are at 78% of eligible Ontarians have their first dose. We'd like to get up to 80, and that's only creeping up 0.1 or 0.2% a day. We're at 54.6 that have had their second dose. We'd like to get at least 20 percentage points higher. So it's a challenge, really, to all Ontarians. If we want to move safely and effectively through step 3 to a complete reopening of our economy, we've got our work cut out for us. We had been going up approximately 10% a week on second doses, so we have the time frame to do it. But you've seen from the numbers that Dr. Yaffe presented today, our immunization rate was going to 220 to 230 people a day, and we're down now to 200,000 Ontarians a day. So I can understand in the summer that we're just having options that we're perhaps going to cottages or parks, but please consider getting immunized along the way or before you go. The immunization are very accessible now through multiple different domains, your pharmacist, your primary care, mass immunization clinics, walk-in clinics. Even if you go up north to a cottage, you may be able to find an immunization center near that facility. So please continue to seek out and get your first or second doses. It's a challenge to all Ontarians. If we want to get through to the next phase of reopening, which is complete reopening with no public health measures, we've got work cut out for us.
Next question.
Your next question comes from Prabjot Sahal from Red FM. Please go ahead.
Thank you, doctors, for taking my question. There were reports in the morning about a few people refusing to follow through the mix and match vaccine strategy in Brampton and refusing to get a vaccine which was different from the first vaccine they had taken. So there's some sort of evidence that there is a hesitancy when it comes to mixing the strategy after what statements have come from WHO. How are you planning to address this sort of hesitancy, and especially in the light of that there might be a need of a booster shot, and that could very well be a completely different vaccine that they had taken for the first or the second shot?
So I'll just respond. The boosters would mainly be for those that are immune suppressed, those that are undergoing cancer therapy, or those that are immune suppressed because of the medications they have to take. So very specific and small population. For the general population, the immunity levels that are being provided through 2 doses are proving to be long-acting, both cellular immunity and antibody production. So we're not seeing evidence for the general public to require a booster dose at present. It may be that only for vulnerable populations would need it, such as frail elderly and those other populations. I want to reiterate our strong commitment to the NACI guidelines of the mixing or interchangeability of vaccines. They're based on well-known immunization principles in Ontario and in Canada and internationally. These vaccines, the mRNA vaccines I'll speak to specifically, are authorized for the same purpose, to prevent COVID-19, have the same indications, the same schedule, are for the same population. They contain or produce a similar type of antigen and hence the same type of antibody response. They have very, very similar safety, efficacy, immunogenicity, and reactogenicity. So we completely agree with the NACI approach and declaration of the interchangeability of the mRNA vaccines and the ability to follow AstraZeneca with an mRNA vaccine if that's the decision that the individual makes. These principles are well known internationally and accepted internationally. I think the spokesperson that the WHO had, their statement was taken out of context and does not change our principles and our approach to the use of mRNA vaccines in Canada and or in Ontario.
Follow up?
I just wonder if I could add to that. I do want to say that it is extremely unfortunate if people are turning away because they're being offered a different vaccine. We consider them to be the same vaccine. They have the same characteristics, as Dr. Moore said. And I think, how are we going to address this? Obviously, we're giving this information now. Each health unit will be getting information out, but I would strongly encourage individuals who are concerned, who have any questions, talk to your physician, talk to your family doctor, talk to your pharmacist, go to the clinic and ask questions, because we know a lot about these vaccines. We know it's safe. We know it's effective. And so please don't hesitate. Thank you.
Follow up?
Thank you, doctors, for that information. My second question is that currently in Ontario, there is a very good vaccination rate. But once the economy opens up and people come in from other provinces, will there be a concern of not having a vaccine passport and not knowing who else is vaccinated?
So the good news is that across Canada, the immunization rates are very comparable, both first and second doses. So Canada is making great progress coast to coast on having a broad-based uptake and acceptance by Canadians of immunization. So I would have no concerns of visitors to Ontario. We all should take the normal precautions. If you develop symptoms, get tested. So symptoms such as a fever or cough or increasing shortness of breath, loss of taste or smell, please go get tested at any assessment center for COVID-19. Please continue to practice good practices such as hand hygiene, physical distancing, wearing a mask when you're in any congregate setting. In any business, they should be screening before you go in for signs or symptoms of COVID-19. All of those basic practices have done us very well in the past, even before vaccine. And now with vaccine, it is getting safer and the risk is getting less, but it's not zero. We all have to still adhere to all the best practices.
Last question.
Your last question comes from Dave Woodard from AM 640. Dave, please go ahead.
Good afternoon, doctors. Thank you. Dr. Moore, on vaccinations, you keep saying that we need to get to a certain level to reopen safely. But what if we never get to that 75% fully vaccinated range that you want to get to? Are we going to be looking at staying in this third stage indefinitely?
Well, I have complete confidence in Ontarians coming forward and getting immunized. I absolutely think that this rate is achievable. As I said, we're at 78. We need 2 more percentage points to get to 80, which was the declared goal for leaving step 3 and opening the economy. And we've got around 20 percentage points to go on second doses. And within 3 weeks, I absolutely think Ontarians can come forward and achieve that. The vaccination rate alone is not the only metric that we're looking for. We're also looking for decrease in hospitalization, decrease in the number of people in the intensive care unit, decrease in number of new cases, ongoing good surveillance that tells us that many people are getting tested, and of those tests, very few are being positive. Those are some of the indicators that we monitor in conjunction, in partnership with how well our population is protected through immunization. And we monitor those data points every single day and are reviewing them, and all of them are trending in the right direction. And I do have very good confidence in Ontarians coming forward to get that immunization rate at the 81st dose and 75 second dose. We've also done modeling that shows that Delta is highly transmittable, and we would like the highest rate possible above that to be able to limit its spread. Some of the modeling points to around 90% that we'd have to achieve to decrease a significant burden on our healthcare system, hospitalization, and intensive care use in the fall. So we won't stop after 80%. We'll continue to encourage vaccination through all of our partnerships that will continue in the fall through pharmacists, primary care, and public health at a local level. But to move from step 3 to a complete reopening, I do have confidence we can achieve that number.
Follow up?
Thank you. You also said earlier in your prepared comments that Ontario teens, they need to get their numbers up. Now, those 12 to 17, they weren't permitted until May 31st to get a vaccine. And even then, they couldn't get a second dose after 4 weeks right away. But it sounds like you're blaming teens for not getting vaccinated fast enough. Is this not more a case of public health changing its guidance as it went along and it being up to the agency then to get the vaccine to those children and not the other way around?
You know, you raise a good point. I don't want to blame anybody. Access and availability was limited until recently for the 12 to 17-year-old age group, and we've had remarkable progress. We're at 60.6% of 12 to 17-year-olds have had their first doses, 21.8% have had their second doses, and we've got 6 to 8 weeks before school starts for this population to get their doses. And we know summer also distracts, and there's other other pressing issues for families. This is just a reminder that we want the safest opening possible for our schools in the fall, and high immunization rates are the means by which we can achieve that. And so call upon all families. If you're hesitant, talk to your healthcare provider. If you have concerns, get those questions answered, and ensure that you've reviewed the opportunities to get immunized and made an informed decision.
Thanks, everyone.